Good afternoon, Ms. G.
Good afternoon.
I can see from your chart that you were recently admitted to the hospital with a stroke. How are you feeling?
I'm actually feeling pretty good, I think. I'm tired, and I don't think it's because I'm not getting sleep. I feel like I fall asleep all the time. As soon as I sit down from doing something around the house, I just doze off for 20 or 30 minutes. It takes me all day to get dressed, make breakfast, and tidy up to start dinner when my daughter gets home.
Well, did they talk to you about how the stroke happened and what the recovery process would be like? And did they address your risk factors that you can manage or eliminate to prevent a subsequent stroke from happening?
Yes, they told me because of my family history of cardiovascular disease and the fact that I also have cardiovascular disease with my high cholesterol and my high blood pressure.
Yeah. Did they talk to you about your blood sugar control?
They did. They said it would be really important for me to receive additional education and management assistance, as it would be even more important now that I have had a stroke to control my blood sugars, so I don't damage all the small vessels around my stroke. I don't want to make my stroke worse.
That's true, but it looks like your hemoglobin A1C is trending down over the last 6 months. So let's make sure you get that current education and teaching as soon as possible. I believe they offer it here in our multi-specialty clinic. They have nurse-only visits to address this type of education, teaching, and monitoring, so availability should be pretty good. We'll give you the contact information, and if you have a hard time getting an appointment, let us know and we can try to help. It looks like your blood pressures have also been trending higher than baseline since your hospitalization. Ms. G, I have to ask, have you been taking your medications as prescribed?
Sometimes I'm so tired in the evening, I'll forget to take my pills. But if I'm awake and I remember, I always take them. I took them last night. How's my pressure today?
Well, today it actually looked well controlled. It was 138/74, and your heart rate's a nice strong 71. But that's because the medications work.
Well, that's good.
Ms. G, let me go ahead and see how your exam compares to your prior to your stroke. Would you mind?
None at all.
I want to make sure we get as accurate as an assessment as possible, and since you're already feeling fatigued, let's go ahead and start with the neurological exam first. Can you tell me what month we're in?
October.
And can you tell me your age?
61.
Great. Can you open and close your eyes? Keeping your eyes closed, can you clasp your hands in prayer position? Good. Go ahead and relax. Can you open your eyes? Sorry. Can you follow my finger? Good. Excellent. Go ahead and look forward for me. Forward. All right, I'm going to ask you, can you see my fingers in your peripheral vision?
Yes.
And over here?
Yes.
Excellent. And how many fingers am I holding up?
2.
And over here?
2.
Okay, I'm going to have you go ahead and close your eyes. Go ahead and keep them closed. Does the sensation feel the same on both sides?
It's a little less on the right side.
Okay. Go ahead and open your eyes for me and smile real big. Good, and relax. I'm going to have you raise your eyebrows for me. Good. I'm going to have you close your eyes nice and tight. Don't let me open them, don't let me open them, don't let me open them. Good. Okay. Sit up nice and straight for me. Go ahead and hold your hands out, palms down. Good. Now I'm going to have you relax for just a moment. Hold your hands straight out to the side for me. Have you reach in and touch your nose with one finger. Good. Now the other side. Good. All right. I'm going to ask you to go ahead and lie back down. Go ahead and lift this leg off the table for me and hold it. Good. And relax. And this leg. Good. And relax. I'm going to ask you to take this heel, slide it up your shin all the way to your knee. Back down. Good. And the other side. Good. Back down. All right. I'm going to take this pin. You're going to feel some pricking sensations. My intention is not to hurt you, so if it's too sharp, let me know. Okay. I'm going to have you go ahead and close your eyes. Can you feel the prick sensation on both sides?
Yes.
Does it feel the same?
It's a little less on the right side.
And here?
Again, a little less sharp on the right side.
How about down here?
Same, less sharp on the right side.
Okay. Go ahead and open your eyes for me. I'm going to have you look at a picture for me. Can you describe what's going on in this picture? Are you able to see it?
Yes. Some kids are stealing cookies while mom is washing dishes, and the sink is overflowing with water.
Good. I'm going to ask you to identify some objects in this picture. Can you name the objects that you see?
A glove, a cactus, key, chair, feather, hammock.
Excellent. I'm going to ask you to read a few short sentences for me, each one once.
You know how, down to earth, I got home from work. Near the table in the dining room, they heard him speak on the radio last night.
Good. I'm going to ask you to repeat some words for me. Mama.
Mama.
Tip-top.
Tip-top.
50-50.
50-50.
Thanks.
Thanks.
Huckleberry.
Huckleberry.
And baseball player.
Baseball player.
Excellent. All right. Are you comfortable?
Yes.
Okay, I'm going to have you go ahead and open your mouth for me. Stick out your tongue. Say, ah. Ah. Excellent. Stick out your tongue. Wiggle it from side to side. Good. I'm going to shine some light in your eyes, okay? Go ahead and lift your head. Good. While you're nice and relaxed, I'm going to go ahead and listen to your heart and your lungs and your belly. I'm going to start with your heart, so just go ahead and relax. Take some nice deep breaths for me. Nice deep breath. Yeah. Good. And one more. Good. Just going to move your hands to your side. Sounds like you're hungry.
I am a little bit.
Well, I don't hear any arrhythmias or murmurs. Are you having any chest pain?
No.
Any shortness of breath or coughing?
No.
Especially when eating or drinking anything?
No.
Okay. How about your appetite? Any nausea or vomiting?
No.
Any diarrhea or constipation?
No.
And when was your last PM?
Yesterday.
Okay, good. You having any pain with urination?
No.
Any difficulty emptying your bladder?
No.
Have you noticed any changes to your urine, dark color, or foul smell?
Oh, no.
Okay. And any episodes of incontinence?
No.
Okay, good. Any falls at home?
No.
Do you have any pain with sitting or standing?
Mm-mm.
And I know you have some arthritis, so I'll be gentle with you, but I just want to kind of feel your joints, and I'm going to do some passive motion here. Any pain with movement?
No.
You have some arthritic clicks, but to be expected. And check your pulses. You take Celebrex for your arthritis?
Yes.
And gabapentin for your neuropathic pain?
Yes.
And how are those helping to control your pain?
If I miss a dose, I definitely feel it.
And how often are you missing a dose?
Like I said, lately I just fall asleep. Still in my clothes, sometimes with my shoes on.
That's not good. Well, your skin looks good. Any issues with bruising or bleeding since they started you on the Plavix?
No, I don't think so.
And you haven't noticed any blood in your stool?
No, I would have called about that. I know that's not good.
All right, good. You can relax. Well, it seems like you have some lingering mild right-sided deficits to sensation, but your functional use is good. Your speech is intact, although I do notice some very mild word finding difficulty. As you stated, you feel pretty fatigued, but because your stroke involved the thalamus, which is in your midbrain right above the brainstem, and its primary function is essentially to be the liaison between your cerebral cortex and the midbrain, relaying all your motory and sensory signals, it's to be expected that sensation or motory function would have been affected. I think an additional part of that weakness could be just some good old-fashioned deconditioning. While I definitely think it's good for you to be taking it easy and allowing yourself some time to rest and recover, I think it's more important that we get you started on your outpatient physical and occupational therapy that was recommended at discharge. So,
Okay.
I'm going to ask our nurse navigator to go ahead and give you the contact information for some therapy offices that are close to you, and she'll contact you on Wednesday, which gives you 2 days to go ahead and make the first appointment. Okay. Besides your daughter, who's in your support network?
Well, I used to go to church every Sunday, and there's a lovely women's group there. I also used to volunteer with the Assistance League, but I'm not sure I'm up to that right now. I have a few friends I used to teach with who have called and check in on me, offered to help out. The hospital gave me information on the community support group for stroke survivors. The next meeting is next week, and I was planning on going to that with my daughter. Overall, I'm just trying to gather myself and make a plan for some adjustments, you know. The stroke happened a week ago now, and, well, I guess I'm scared because the risk of me having another stroke is pretty big. And, well, that's just sort of paralyzing. But as I continue to feel better and adjust to some of the changes, I need to make it, will get easier, right?
Easier, I can't make any guarantees, but I want to make sure that you have the support and resources to make the changes to lower your risks, as well as have the appropriate support and healthcare management to help you maintain changes. So I'm also going to ask our nurse navigator to call and speak with your daughter about supervising your medication administration, at least until you're feeling better and feeling more rested. Would that be okay?
Yeah, I think so. I could use the reminders.
Okay. We'll make your next follow-up appointment for about a month from now, but our nurse navigator this week. Then she'll check in with you and your